Middle trapezius. With middle trapezius, you want to make sure that the shoulder is externally rotated or the thumb is up towards the ceiling. And then what you do is you position the patient with their arm up off the table and have them hold that position. All right? If they're able to hold, then you stabilize on the opposite shoulder and give resistance down towards the table. Have them hold, hold, hold. Good. Lower trapezius, now we elevate the arm, bring it up into elevation. Again, the shoulder's externally rotated or the thumb is up, and we have the patient raise off the table, have them hold. All right. Once they're able to hold, we can add resistance, stabilizing on the opposite shoulder, and then giving resistance down towards the table. Hold, hold, hold. Alternate rhomboid manual muscle testing. Now the shoulder is internally rotated fully. The thumb is down towards the floor. We have the patient raise the shoulder, raise the arm and forearm and hold. Right. Once they're able to hold that position, we can stabilize at the opposite side of the shoulder and scapula, and then we can resist downward towards the floor or table. Hold, hold. Good. Upper trapezius, manual muscle testing, have the patient elevate or shrug their shoulder. They rotate to the opposite side and side bend slightly toward the side that you're testing. And then you would resist downward and have them hold. Serratus anterior is tested with the patient in a supine position, shoulder flexed to 90 degrees, elbow and wrist extended. Have the patient make a fist and then punch up towards the ceiling. If they're able to hold that position, there's no fixation required, and you can just push down towards the table and have them hold. We're going to do manual muscle testing of the deltoids. So when we look at the deltoids, remember we have three components. We have the anterior deltoid, the middle deltoid, and the posterior deltoid. So we'll start out with anterior deltoid. And with anterior deltoid, what we want to do is we want to position the patient in abduction with slight external rotation. We want to stabilize at the shoulder, and then we'll give the resistance on the anterior distal arm. And when we give resistance, the patient will be pushing into slightly forward into flexion, all right, and abduction. So when we do resist, we'll go downwards and towards the body. Hold, hold, hold. Good. Then we can move to the middle deltoid, which is right here. With the middle deltoid, we position the patient in about 80 degrees of abduction. We have neutral rotation, so no external rotation or no internal rotation. Neutral rotation. Again, we'll give resistance at the distal arm. We'll stabilize at the shoulder, and we'll have the patient hold, hold, hold. Good. And then last, we'll look at the posterior component of the deltoid. With the posterior deltoid, we position the patient again in abduction, and now we put them into slight internal rotation. We stabilize at the shoulder, we have them hold that position, and then when we give resistance, we do it at the mid to distal humerus, and we push kind of posteriorly and laterally in a posterior lateral direction. So she's pushing backwards towards me, and I'm pushing forward and slightly down. Hold, hold, hold. Good. The next muscle we will test is the coracobrachialis. So the coracobrachialis runs from the coracoid process of the scapula to the proximal humerus. When we test this muscle, what we want to do is the muscle adducts and flexes the shoulder, the arm. So what we want to do is we want to take the biceps out, the long head of the biceps, by flexing or putting the biceps in active insufficiency. We want to stabilize at the shoulder, and then what we'll do is we'll give resistance downward with the hand and slightly out towards me. So the patient will push up and pull inward, and I'll give slight outward and downward resistance. Good. The next muscle we're going to test is the pectoralis major muscle. The pectoralis major has two components. It has a clavicular portion and a sternal portion. So the clavicular portion up high and the sternal portion down low. We'll start out with the clavicular portion. So to muscle test this portion of the pectoralis major, position the shoulder in 90 degrees of flexion, slight adduction and internal rotation of the shoulder. You want to stabilize the opposite shoulder of the patient. You want to give resistance at the proximal forearm, and the resistance will be, the patient will be pulling across the body. And you'll be holding, so hold, hold, hold. Good. Then the next portion is the sternal portion. So when testing the sternal portion, you want to bring the shoulder down into about 50 degrees of flexion. Again, slight adduction. Keep the shoulder in internal rotation. Stabilization will now be on the ASIS area. Again, resistance will be at the proximal forearm, and the patient will kind of be pulling in a diagonal direction, kind of down towards their hip. So we'll have her hold there and give resistance. Hold, hold, hold. Good. The next muscle we'll be testing is the pectoralis minor. So the pectoralis minor goes from the coracoid process down to the ribs, so it kind of travels this way, and its action is that it protracts the shoulder. So to test this muscle, you want the patient supine, their arm at their side. There's really no stabilization, but I kind of like to give the patient some stabilization up towards the shoulder area. So you have them protract up, and then your resistance would be down towards the table, so you're resisting them. So hold, hold, hold. Good. Next, we're going to test the supraspinatus muscle. The supraspinatus is part of the rotator cuff. So for this manual muscle test, what we do is we position the patient in 90 degrees of abduction at the shoulder, and then we have them side bend or laterally flex towards the side we're testing and rotate their cervical spine away. All right, we can stabilize at the shoulder. We have them hold that position, and then we can give resistance. Hold, hold. Good. Now what we're going to do is we're going to test teres minor and infraspinatus, the external rotators of the shoulder, and we'll test these together. So when we're testing these, what we do is we position the patient prone, we put a towel underneath the arm, put her in a neutral position, 90 degrees of abduction, we can stabilize just above the elbow, about 75 degrees of external rotation, and we want to see if the patient can hold. Right? And then we can give resistance, and we're going to resist downwards as the patient presses up. Hold, hold, hold. Good. All right, and then After we test external rotation, then we can test internal rotation, looking at subscapularis and teres major. So what we want to do is, again, keeping this position 90 degrees of flexion, we can stabilize at the elbow, the arm supported with a towel. 45 degrees of internal rotation, and then again resisting at the distal forearm. Hold, hold, hold. Good. And then if we want to isolate the subscapularis, we can kind of do a muscle test / special test. And what we have the patient do is place the back of their hand in the small of their back, and then what we have the patient do is lift up, and we can see if they can hold that. Alright, and then we can stabilize at the shoulder and give resistance downward. Hold, hold, hold. The next muscle we'll be testing is the latissimus dorsi. So latissimus dorsi right in this area, attaching onto the humerus. So in order to test this muscle, we position the patient prone. We put them into slight extension, slight adduction, and internal rotation of the shoulder. And you can have them hold that position. All right. Stabilize the opposite side of the trunk, and then resistance just above the elbow. And hold, hold,